Good evening. My name is Brigita Graciela and my student number is 181. Tonight I will doing my presentation about public healthcare in Indonesia. The public healthcare system in Indonesia is administered in line with the decentralized government system in Indonesia with central, provincial, and district government responsibilities. The Central Ministry of Health is responsible for management of some tertiary and specialist hospitals, provision of strategic direction, setting of standards, regulation, and ensuring the availability of financial and human resources. Provincial governments are responsible for management of provincial level hospitals, provide technical oversight, monitoring of district health services, and coordinate cross-district health issues within the province. District or municipality governments are responsible for management of district or city hospitals and the district public health network of community health center or puskesmas and associated sub-district facilities. Next is history of public healthcare in Indonesia. Modern public healthcare was begun by the Dutch to safeguard plantation workers. It expanded to hospitals and midwifery centers in towns and some rural health facilities. The modern healthcare system continues the Dutch colonial pattern of low levels of investment in healthcare. The Dutch did relatively little in the field of public health prior to 1910, with the exception of giving smallpox vaccinations. In the 1930s, however, the government devoted increased attention to health education and disease prevention, particularly in rural areas. An elaborate public health infrastructure had developed by 1939, including a particularly sophisticated model program in Purwokerto in central Java. But this public health system collapsed after the Japanese invasion in 1942. During World War II, the mortality rate rose dramatically and the general health situation of the country deteriorated. And then, during the New Order, public health and family planning became a priority for rural areas, and about 7,000 community health centers and 20,500 sub-health centers were built by 1999. In the post-war period, a network of maternal and child health centers was established, but resources were extremely limited, with just one physician for every 100,000 people. The first dramatic improvements resulted from the establishment of the network of community health centers in 1969. Although at first the general population strongly resisted using these facilities, by the time of 1980 census, 40% of people reporting illness in the prior week had sought treatment at one. By 2005, the community health centers catered largely to the rural and urban poor, and most urban residents who could afford to do so sought health care from private physicians and clinics. The government's 5-year economic development plan, community health services are organized in three-tier system with Puskesmas at the top was established in 1969 as part of the First Republika. Since the early 1990s, the Department of Health planned to have 3 to 4 subcenters per health center, depending on the region, and this plan has been largely realized in the 21st century. And then in the late 1990s, there were with 0.66 hospital beds per 1,000 population, the lowest rate among members of the Association of Southeast Asian Nations or ASEAN. In the mid-1990s, according to the World Health Organization or WHO, there were 16 physicians per 100,000 population in Indonesia, 15 nurses per 100,000, and 26 midwives per 100,000. And then the use of modern forms of healthcare has increased. For example, in 2003, the United Nations Children's Fund, or UNICEF, reported that 68% of births in Indonesia were attended by a trained midwife or other health specialists, compared to 58% in the late 1990s. Recent studies show a correlation between the rise of education levels and the increased use of hospitals, physicians, and other health resources. The government introduced a national health insurance program in 2014. And then the Asian financial crisis affected government expenditure on health, causing it to fall from $6 to $1 to $3 per person per year. However, government expenditures on health recover and even surpass pre-crisis figures at $8 per capita per year by 2007. In 2007, the health budget reached about 18.5 trillion rupiah, of which 8.3% was allocated to the Directorate General of Disease Control and Environmental Health, and about 1.2% was allocated to the National Institute of Health Research and Development. In other words, Indonesia spent $1.8 billion on disease control and research. The health budget in 2007 had increased threefold from that of 1999. Next is the advantage of public healthcare in Indonesia is compared to private healthcare. In public healthcare, the cost of treatment is cheaper and can be reached by all people. And the disadvantages of public healthcare in Indonesia are: first, health workers in rural areas are less experienced with existing health facilities or health equipment. And the last is, since public healthcare in Indonesia is managed by Indonesian government, which has improved healthcare access for the poor, as a result, public hospitals are often overcrowded. I think that's all for me. Thank you very much.